Hello, my name is Mark Murphy. I'm one of the study team with the ADAPT EMA Data Collection Project. ADAPT stands for Activity Data for Early Medical Abortion Care in General Practice. And as you might know, it's a collaboration between Trinity College. The principal academic investigators are Professor Catherine Conlon, Caitlin Bratt, and also START doctors that you know, like Mary Favier and Trish Horgan. There's also a wider START research support group of GPs supporting the study. This video is for GPs who have consented to be involved in the study. So they've returned the recruitment form and the GP consent form, but maybe they haven't started returning patient data. They haven't submitted the first patient data collection form yet. So this video will hopefully help you to learn what the steps are to start providing the monthly data returns so that we can learn more about what is happening in early medical abortion in general practice. Just as a snapshot of some of the data that has been collected so far, and I stress this is very early data and it's not to be disseminated, examples of the information that we're receiving would be that approximately 21% of the women from the data that's been returned have required an ultrasound. Approximately 8% of women have been referred to a maternity hospital after visit 1 and before visit 2. And up to 15% of women have experienced an EMA complication, and that could include something like mild bleeding. I would also say that your involvement in ADAPT will also support 15 out of your 50 points requirements, including supporting your practice review that was formerly called an audit. So that will be 10 points of the 50. So that's another incentive, I suppose, to get involved. Okay, without further ado, let's start. So there are 3 items needed to complete your first data return. The first thing you need is an Excel dataset, which Caitlin and the study team will send to you, and you will keep that on the hard drive in your office, in your practice. The second thing is that you're going to have to open a browser where the data return sheet for the project is. And the third thing will be you open up Socrates, Health One, Helix, etc., your electronic health record to look up the patient. The next thing to think about is, when do you do the return? And there's no hard and fast rule, but the general consensus from the study team and GPs who have been involved is that it makes sense to do it at the end of the month. And you will look back at the data set, the Excel file that has all the My Options patients you see included in it, and you'll only then do the return for patients who have completed a visit 3, or you are satisfied that the end of their early medical abortion process is finished. So if someone has had a visit 1 just before the end of the month, you will not return their data. We want to wait until the visit 3 has happened and the GP has kind of clarity about what happened, were there complications, was it a successful early medical abortion, etc. Okay, let's have a closer look at the Excel file. The GP identifier will be sent to you by the study team, and in this example it's 001, and that is the first column in this data set. The next ID is very important, and this is an ID that you are going to make for the patient. And in this example, the first patient I've put in here, I've given them the ID EMA1. The next patient in the next row could be EMA2, etc. This is the study ID that you will put in the data return. So that is what makes it anonymized. So you never submit a date of birth or a name into the data return. It's only this patient ID, which is anonymous and is kept on your computer in your practice. You'll record the date of the first visit. Only patients who will have consented to be part of this research project will be included. So you'll record that here. You'll put in the patient's name here. So in this example, it's Jane Doe, but And just to stress again, this will never be disseminated outside of your practice, but this is a key to link the patient ID number to the name, because sometimes the study investigating team might come back to you with a query about patient EMA1, and in a few months you'll have forgotten what that patient ID, who that patient ID number refers to, so you'll use this Excel file to link it in your own consultation room. When you have completed the data entry, so that is when visit 3 has been completed, you will insert yes here. So that's the first thing I'll say, that's the Excel file. So let's just say, as a thought experiment, we're going to do our data return at the end of the month of October, and we've only seen one MyOptions patient in the practice. And I'm going to do a data return for this patient. So the visit 1 was on the 13th of October. The visit 2 was 3 days later, which was the 16th of October. And 2 weeks later, I do a follow-up visit 3 with the patient, and I confirm that it was a successful early medical abortion and the low sensitivity pregnancy test was negative. So I'm going to do a data return for this patient because visit 3 is completed. So looking at, in this case, Socrates, you can see that I have recorded 3 consultations here, visit 1, visit 2, visit 3. I'll have Socrates open for this patient so that I can extract the data for the data collection form. And I just repeat that this patient did consent to be involved in the study. So now I go along to the data collection form. So when you open I would recommend firstly having this as a saved item on your browser so it's easily accessible at the end of the month. And it's very straightforward. You just have that open on your computer beside the patient. Okay, so let's do one data return. So let's just say there's only one patient that was seen in the practice over the last month, and I'm going to do a data return at the end of the month. So I open up Socrates, I have the Excel file open, and I open up the browser and the data collection website. So I'm now going to insert the patient information. This will take approximately, I think, about 1 minute and 40 seconds for this patient, just to give you a rough idea of how long it takes really for each data return. So it's pretty quick. So starting, you can see that the first thing I do is I put in my GP ID number, and in this imaginary case it's 001. The next important information is that I put in the unique ID that I've created, and only I know this that this ID links to the patient Jane Doe in my practice. So in this case, the ID is EMA1, and then I just continue to insert information all the way down, and I'll kind of speed through this because it's not so important for you, but you can see this was kind of an uncomplicated EMA, and after approximately 1 minute 50 seconds, I will then hit submit. And for each, so sometimes, particularly when it's not a standard EMA, there will be qualitative text, and inserting as much information as possible, inserting as much information as possible is kind of key to I suppose for the research team to tease out the complexity and nuances of these consultations in general practice. So that is the end of the video. So just to summarize, there are 3 items you're going to need to complete your first data return. The first thing is an Excel dataset. The study team will email you a sample Excel dataset, and every patient that consents to be involved in the study who has an early medical abortion in your practice will be put in this Excel dataset. And at the end of every month, for all those patients who have had a visit 3 or the process is completed, you will submit their data in the data return sheet, which will be a saved website on your browser. And obviously you will have your electronic health record open so that you can find the patient information relevant to each case. And it should take less than 2 minutes for each patient that you return data on, unless it's a little bit more nuanced and you need to type some qualitative or narrative kind of text for the research team. You're probably going to do the return once at the end of each month, and you're going to look back on all the visit 3s. It's really important, just lastly, that you insert the patient ID, in this sample case EMA1, that you put that into the patient chart as well somewhere, just so that record is kept. I hope that's helpful. Thanks very much.